The starting point for our paper is the understanding that healthcare encounters frequently require unusual or specialised forms of participation from the patient or client. Physical examinations, for instance, can be unfamiliar or embarrassing, and more complex investigations can cause discomfort or prove demanding. They also sometimes require the client to display the production of an unwitting response rather than a reasoned one, non-symbolic rather than symbolic conduct. In the paper we investigate these phenomena using video data of eye care consultations. A common test in eye care consultations, known as subjective refraction, transforms the client's normal experience of seeing and requires a specialised form of participation. In the UK, subjective refraction usually takes place with the client wearing a set of trial glasses frames and beginning with one eye covered or occluded. The optometrist then brings a lens in front of the uncovered eye and asks a test question to elicit any changes in the quality of the client's vision. It is, of course, highly unusual in daily life that someone brings an object towards our eye, and a normal response might be to move away from it. Subjective refraction requires the client to remain still, looking forwards. Clinical demands of the test also require the lens to be centred over the eye and held in place for a period of time that enables the eye to adjust to it before the client is able to give an accurate response to the test question. There is a clinical preference for an immediate response to this question rather than a delayed one, as it indicates that the client is reacting to the lens rather than thinking about it. We've investigated how optometrists encourage and enable clients to participate in this specialised manner and secure the successful accomplishment of subjective refraction. We find that a key role is played by the gesture through which the optometrist brings the lens in front of the client's eye. This arc-shaped movement has a stylised, exaggerated quality. It enables the lens to be centred accurately over the eye, whilst also animating and projecting its travel, providing time for the client to prepare for its arrival. We also find a close coupling of the lens placement and the timing and delivery of the test question. This coupling ensures that the client becomes interactionally able to answer the test question, at the same time he or she becomes clinically able to do so. And this encourages an immediate, non-reasoned, unwitting response. The stylised and functional character of the lens placement gesture leads us to think of it as a professional gesture, and we regard the unfolding of subjective refraction as an instance of socialisation in healthcare. Finally, drawing on Bloomer's distinction between symbolic and non-symbolic interaction, we can begin to identify and investigate instances in healthcare practice that require the production of an apparently immediate, unfettered response to a particular stimulus in order to achieve the successful accomplishment of diagnosis or assessment.